This is an intensive care unit for newborn babies. Babies who are too small or too sick to go home with their parents have to spend time here. Most of these babies are premature. That means that they were born too early. This can happen when the mother goes into preterm labor. In this program, I'm going to be talking about what preterm labor is and why you need to know its warning signs. Pregnancy normally lasts 38 to 42 weeks after the last menstrual period, or about 9 calendar months. Normally, labor begins between the 38th and the 42nd weeks. Labor is the process in which the uterus contracts or tightens to prepare your body for the birth of the baby. Preterm labor is labor that occurs too early, anytime before the end of the 37th week of pregnancy. Because babies continue to grow throughout all 9 months of pregnancy, babies that are born too early may not be fully developed. As a result, they may die soon after birth, or they may suffer from permanent disabilities. Even babies that eventually go on to live healthy lives may have to spend a long time in the hospital, which can be very stressful for the family. We know that some women are more at risk for preterm labor than others. These include women who are carrying more than one baby, those who have had previous preterm labor, and those who use illegal drugs, especially cocaine. But even women without risk factors can experience preterm labor. Because we don't fully understand preterm labor, we can't prevent it. But if we identify it early enough, we can treat it and often stop it. That's where you come in. If you know the warning signs of preterm labor, you can call your doctor or your clinic should it occur. One sign of preterm labor is uterine contractions. Contractions are not always painful. Often they're just a mild tightening of the uterine wall. If your uterus feels tight and hard when you press against it, you are having a contraction. Contractions can be perfectly normal and often occur when you change position or when you're tired. But if they occur 4 or more times in 1 hour, it could be a sign of preterm labor, and you should take the following steps. First, drink 3 or 4 glasses of water and lie down on your side. If the feeling goes away within half an hour, continue resting a while. If the contractions continue, call your healthcare provider immediately. In fact, you should call your healthcare provider if you experience any sensation between the chest and the knees that lasts for more than 30 seconds, but less than 2 minutes, and that occurs 4 or more times in an hour. Besides uterine contractions, other symptoms that may mean you are in preterm labor include abdominal pain or cramps, a feeling that the baby is balling up, pelvic pressure, a feeling that the baby is about to fall out, lower back pain, upper thigh pain, or a change in vaginal discharge, such as bloody or watery discharge. Again, if you experience any of these symptoms, drink 3 to 4 glasses of water and lie on your side for half an hour. If the symptoms don't go away after resting, call your healthcare provider. If it turns out that you are in preterm labor, treatment can be started that usually will stop that labor and delay delivery. That can mean the difference between a healthy baby and a baby that has to struggle for every breath. For no matter how advanced technology becomes, it can never replace the time a baby spends inside its mother. Calling your healthcare provider if you have any of the symptoms of preterm labor is one of the most important things you can do to ensure you have a healthy baby. Remember, many of the signs of preterm labor are also signs of normal labor. The difference is that they occur too early, before the end of the 37th week of pregnancy. These signs include uterine contractions or any sensation located between the chest and knees that lasts for more than 30 seconds but less than 2 minutes and that occurs 4 or more times in an hour. Abdominal pain or cramps. A feeling that the baby is balling up. Pelvic pressure. A feeling that the baby is about to fall out. Lower back pain. Upper thigh pain, or a change in vaginal discharge, such as a bloody or a watery discharge.